Hello and welcome to our informal debate. My name is Nicole Hansen and I will be the introducer moderator for today's informal debate on the topic of standardizing evidence-based practices in ethical necessity. Other members that will be joining me for this discussion are Natalie Chatto, our summarizer, Natalie Cutting, our illustrator, Ashley Africa is the researcher for the debate, and Katie Chonko is the group's fielder. First, let's begin with a definition of evidence-based practice. According to Slocum et al., evidence-based practice, or EBP, is a model of professional decision-making in which practitioners integrate the best available evidence with client values, context, and clinical expertise in order to provide services for their clients. Although using EBPs follows a framework for treatment, several factors are taken into consideration. It is not a cookie-cutter approach, meaning it can be individualized based on a client's needs and environment. Clients are taken into consideration when applying treatment. Collaboration among the client, his or her family, behavior specialists, and other individuals working with the client both in and out of the instructional setting is necessary. The National Autism Center recognizes 14 established interventions that are considered EBP for individuals under the age of 22, which include behavioral interventions, modeling, parent training, scripting, and story-based interventions, etc. The No Child Left Behind Act of 2001 called for the use of effective practices by educators and others who work with children with disabilities. It is our responsibility to remain current on the research of the most effective methods of treatment. According to a publication by the National Autism Center, using EBPs not only requires the application of research, but also professional judgment and decision-making based on data, the value and preferences of families, as well as the student, and the ability to implement interventions accurately. Additionally, there is a strict code of ethics that behavior analysts must follow. One of these codes is reliance on scientific knowledge, meaning we are to use scientifically derived knowledge when making professional decisions. Also, we are obligated to provide treatment and intervention efficacy, meaning we are to advocate for our clients and provide them with treatment that is scientifically supported. With that being said, let's begin with our first argument. Is the standardization of EBPs ethical?
Hello, my name is Natalie Chatto, and I serve as the summarizer for this debate on EBPs. It is imperative to mention that the prevalence of autism spectrum disorder, or ASD, is rising. According to the Center for Disease and Control and Prevention, ASD currently affects 1 in 68 children and adolescents. Therefore, there is a lot of research taking place in search of treatment, such as applied behavior analysis, or ABA therapy, which is one of those treatments that is considered an EBP. Standardized EBP is to make the treatment intervention a requirement and/or to fit a certain guideline that a practitioner has to follow. For example, if a school decided to standardize its grading system, every teacher at that school has to grade the exact same way. Pros to standardizing EBP is that it provides a framework for behavior analysts with a structure for persistent use of the greatest available evidence in multifaceted settings in which they work. Let's look at Slocum et al.'s article titled The Evidence-Based Practice of Applied Behavior Analysis. Slocum et al. Discuss the Behavior Analyst Certification Board, or BACB, guidelines for responsible conduct for behavior analysts, and ways it affirms behavior analysts to base their professional conduct on the best available evidence. The examples the authors use are 1.01, reliance on scientific knowledge, and 2.10, treatment efficacy. Code 1.0 states that, quote, behavior analysts rely on scientifically and professionally derived knowledge when making scientific or professional judgments in human service provision, or when engaging in scholarly or professional endeavors, unquote. Code 2.10 states that the behavior analyst always has the responsibility to recommend scientifically supported, most effective treatment procedures. Effective treatment procedures have been validated as having both long-term and short-term benefits to the clients and society. And then B, clients have the right to effective treatment based on the research literature and adapted to the individual client. Slocum et al. Make 5 points for their argument that EBP in ABA are a must. The first point is that using EBP as a framework draws together various elements of ABA practice into one coherent system, which can help behavior analysts provide a rationale for their decision making to clients and stakeholders. This framework allows behavior analysts to provide empirically based treatment recommendations. The second point is that EBP prompts the behavior analyst to refer to the client values that inspire the goals of the intervention, the precise methods of the intervention, and explain how the intervention is supported. Third, EBP gives the behavior analyst a way to discuss the complex skills required to make decisions about client needs. Fourth, the framework of EBP of ABA suggests further development of behavior analysis and to examine the meaning of best available evidence. Finally, EBP plays an important role in the training of behavior analysts. Slocum et al. Cite the significance of EBP by referring to the following examples: No Child Left Behind Act of 2001, the Individuals with Disabilities Education Act of 2004, and What Works Clearinghouse.
Now Ashley will provide research that supports the standardization of EBP.
Hello, I'm Ashley and I'll be providing research on both the pro and the con side of this debate. Professional caregivers pledge to practice ethically and to make decisions that are right for their patients. Farley and al. Wrote that EBP has been a golden standard for many practices because it provides a comprehensive structure, philosophy, and process. They further discussed how EBP promotes the value of knowledge from many sources, and with these sources, an informed decision on the most effective treatment or intervention can be made. With the increased prevalence of ASD, there has been a higher demand for effective services and intervention. Slocum wrote in 2014 that the best available evidence should be the primary influence on all decisions made to related services for clients in ABA. Droda, Stanek, and Brookman-Frosty in 2012 conducted a study where they looked into the perspective of therapists regarding the delivery of EBP strategies in routine service settings to children with ASD. An individualized mental health intervention for children with ASD, or as they call it, an AIM-HIGH, is a package of evidence-based, parent-mediated, and child-focused EBP strategies based on ABA principles and was created to assist therapists. AIM-HIGH included components classified as well-established by the National Autism Center's National Standard Project and the National Professional Development Center on ASD. Researchers concluded that the AIM-HIGH package increased the skills therapists needed to work with children with ASD. Therapists reported that the AIM-HIGH training and package increased their confidence when working with children with ASD, increased the ability to better understand their clients, and how useful the AIM-HIGH manual was during the intervention protocol. Lambert Lee et al. In 2015 provided a study on translation of evidence-based practices into comprehensive educational models within autism-specific special schools. Researchers tested the Treehouse School, London, United Kingdom ABA-based educational model. Children are taught using a variety of ABA-based techniques depending on the learner and the skills that are being taught. Some techniques used are task analysis, shaping, discrete trial training, natural environment teaching, and reinforcement. Learners were grouped into 6 classes and staffed on a 1-on-1 ratio with ABA tutors and an ABA supervisor or teacher. Data from the study indicated positive outcomes with moderate to large effect size in standard assessments over a 12-month period. There was a significant change across all Vineland Adaptive Behavior Scale standard scores, which means that the participants exceeded the study's expectation.
Thank you, Ashley. Now Natalie Cutting will provide an illustration that supports the pro side of standardizing EBP.
Thank you, Nicole. Standardization is an ethical necessity. Treatments for autism, both evidence-based practices and unestablished treatments, are costly, adding over 17,000 annually for diagnosis-related care. Therefore, it is important to ensure that the money parents and caregivers are spending is going towards treatments that are effective and produce results. Early intensive ABA that usually lasts up to 3 years, averaging $33,000 per year, tends to be expensive when compared to the cost of other unestablished treatments, such as sensory integration therapy at $16,500 per year and relationship development intervention at $10,000 per year. However, this initial investment has a huge payoff. A study conducted by Chasson, Harris, and Neely found that the actual savings of using early intensive behavioral interventions utilizing discrete trial teachings for 3 years when compared to the cost of special education services for one's entire school enrollment was $208,500 per child. With making a sizable investment early on in evidence-based practices at the recommended time commitment, children with autism may develop the skills to be integrated into mainstream classrooms without the need for special education, and furthermore develop into adults that are self-sufficient and employed who do not require financial aid from family members, state, and federal programs. Not only is it ethical to advocate for evidence-based practices to gain effective results, it is also cost-effective and worth the initial investment.
Now we will hear the con side of standardizing EBP.
Smith reports that behavior analysts often say they engage in EBP. However, they express differing view on what constitutes as evidence and practice. In Smith's article titled, "What is Evidence-Based Behavior Analysis?" he argues that EBP must be standardized enough so that behavior analysts can replicate and yet flexible enough to allow individualization. Smith reports limitations of group studies such as randomized controlled trials and quasi-experimental research when it comes to EBP. Smith suggests that behavior analysts favor studies with single subject experimental designs. Smith defines EBP as, quote, a service that helps solve a consumer's problem. Thus it likely to be an integrated package of procedures operationalized and manual and validated in studies of socially meaningful outcomes, usually with group designs. In an article by Prezant titled "The Use and Misuse of Evidence-Based Practice: Implications for Persons with ASD," he writes that individual differences within the spectrum are not taken into account when considering EBP. Prezant states that not recognizing the individual differences in persons with ASD are shortcomings of research in ASD and lacks clear and detailed descriptions of subjects in both large and small sample research documenting such differences. Moreover, the setting of the clinical trials is also arguable in that if a study is conducted at a research site versus an educational setting, it is unknown whether or not the intervention generalizes to all settings for the participant involved in the study. Prezant also states that data is not necessarily evidence of a meaningful progress. For instance, too often frequency counts of behavior are presented as the only source of evidence of the effectiveness of intervention in practice. We should not have to be forced to use a standardized practice when each case is individualized and our guidelines state to use the most effective treatment. I should be able to assess my client and determine what treatment is best and be able to use the data to make such conclusions as a professional behavior analyst.
Now Ashley will provide research that supports this argument.
After reading multiple articles, reviews, and study, there were common limitations and concerns that arose regarding EBP. In the article Ethical Considerations Related to Evidence-Based Practice, Christensen and Liu in 2001 looked at the consideration between what is ethically right and what EBP says in healthcare and occupational therapy. Even though research has been done, there must still be a focus on the relevance to the patient-specific situation. Christensen and Liu wrote that the application of group data to individualized patients is difficult because conditions were never the same for any two patients. Lindgren and Dubé conducted a research on evidence-based interventions for ASD in 2011. They wrote that the scientific method of validation has a negative effect on ASD research due to the procedural restrictions that make it hard to duplicate in real-life settings. Wang et al. In 2015 reviewed 27 EBP for children, youth, and young adults with ASD. They wrote that even though there are multiple studies that supported an EBP, it did not reflect how powerful the intervention is in changing behavior. The EBP they reviewed fell short on identifying EBP for adults with ASD and focused more on the youth or younger adults. Due to the demographics of ASD, more research had been conducted on boys and men, which leaves less known about intervention outcomes on girls and women. They stated the need for expanding the age range of intervention research has been identified by the Interagency Autism Coordinating Committee. In 2015, Hong and al. Evaluated the quality of research on EBP for daily living skills for individuals with ASD and found multiple limitations to their study. First was that the research design and environmental conditions are modified based on the needs of the participant, which leads doubts if the results found for adolescents or adults would be the same as young children. Another limitation is that the lack of information and description on the diagnosis of participants, which can lead people to interpret the research differently and not be able to determine whom the results may be appropriate for.
Thank you, Ashley. Now Natalie Cutting will provide an illustration that supports the con side of standardizing EBP.
As Ashley explained earlier, there is more evidence-based practices for certain populations when compared to others. This can be illustrated with the availability of evidence-based practices based on age. The National Standards Project in 2015 is an initiative of the National Autism Center that utilizes specific guidelines and requirements to measure research-based practicums in treating autism. All the applicable research of a practice was then evaluated. Then the practice is categorized into one of the following labels: established, emerging, and unestablished. Here are the definitions of these labels. The findings and conclusions of the National Standards Project Phase 2 found that there are 14 interventions that meet the requirements to be labeled as established for treating autism in individuals under the age of 22. In comparison, only one intervention was established for treating autism in individuals over the age of 22, and that intervention was behavioral interventions. Also, there are only 17 articles reviewed for behavioral interventions. This illustrates that stipulating only evidence-based practices is unethical due to the lack of evidence-based practices for certain populations, especially in relating to age. How can clinicians and caregivers implement evidence-based practices if it does not exist?
Now, Natalie and Ashley will discuss the pros and cons of societal impacts when using EBPs.
West et al. Proposed contextual factors regarding EBP amongst individuals with ASD. Contextual factors are considered an individual's social and cultural history, identities and experiences, and the intersections thereof. Contextual factors include, but are not limited to, race, age, gender, educational level, disability type, socioeconomic status, sexuality, and severity of problem behaviors. According to West et al., researchers must carefully contemplate contextual factors inherent to applied experiments because the menu of EBPs serve only as starters for professionals and are not a solution for all ASDs. Also, the status of an EBP does not constitute accomplishment of intended positive results for every individual with ASD. For instance, no two individuals with ASD are alike. which can complicate the method chosen for intervention regardless of EBP selected. Participants selected for studies should be clearly defined and identified, or else it is impossible to connect an intervention with an individual who could benefit from it. EBP movement needs to be advanced to understanding contextual factors, which include the complexities involved in each individual's unique history and experiences. EBPs need to arrange environmental conditions that are consistent with the participants' needs. Additionally, children with ASD who occupy marginalized ethnic and linguistic groups are underrepresented in ASD research. These ethnic and linguistic incentives include non-English speaking, non-white, non-Western individuals. Conducting research that takes into account the complexities and intersections of various identity categories will aid in more specific individualized treatment plans for individuals with ASD. According to West et al., most participants in ASD research are white Caucasians. Moreover, it was found that 72% of articles that were published in ASD research did not include descriptors of the participants' race or ethnicity. Therefore, more research in this area could improve and strengthen ASD research for all groups.
The amount of research representing diverse participants in high-quality ASD interventions remains uncertain. West et al. In 2016 analyzed research articles used by the National Professional Development Center on Autism Spectrum Disorder. They wanted to gain a better understanding of the EBP research for learners with ASD and participant diversity. They also want to qualify EBPs for demographics related to race, ethnicity, and nationality, or REN. Their study resulted in only 73 of the 408 studies reporting REN, and of those 408 studies, only 770 of 2,489 participants had reported REN. West et al. Grouped REN into 7 categories according to geographic region and concluded that of the 770 participants who reported REN, 489 were Caucasian, 52 were African American, 40 were Asian, 18 were Hispanic, 10 were Middle Eastern, and 1 was a Native American participant. Without REN being reported, then special education and related resources may find it hard to apply interventions for learners from non-Caucasian and ethnic groups. Overall, they found that low rates of participants' REN being reported and a large majority of participants whose REN was reported were Caucasian.
Natalie Cutter will now provide an illustration.
The following are the tables from the West et al. Study in 2016. The purple circles show that the total number of studies of evidence-based practices. They include both group and single subject designs. There are 28 evidence-based studies that were examined. The green circle shows the total studies that provided REN. It is also important to note that some evidence-based practices did not have any REN data, such as discrete trial training and PACS. This table shows the number of participants for each ethnicity. 10 ethnicities were only represented by 1 participant. This illuminates the enormity of underrepresented ethnicities in research and may not have research applicable to their needs.
According to Cooper et al., the definition of ABA is that it is a science in which the principles of the analysis of behavior are applied systematically to improve socially significant behavior. Thus, it could be argued that EBPs are used to improve socially significant behaviors and enhance the quality of life of an individual. EBPs that are used in ABA principles for individuals with ASD often adhere to the 7 dimensions of ABA that Bear et al. Discuss in their famous article regarding the field of ABA. The 7 dimensions of ABA are applied, behavioral, analytic, conceptually systematic, technological, effective, and generality. Applied interventions deal with issues of demonstrated social importance, and behavioral are applied interventions that are measurable and observable. The other dimensions, such as technological, mean that applied interventions are described in well enough terms that they can be implemented by other professionals. Conceptually systematic refers to applied interventions that arise from a theoretical base that is specific rather than being a set of package or tricks. This one is particularly important when discussing EBPs because EBPs are to be conceptually systematic so that other providers can look at the interventions in a way that is applicable to their clients and choose what intervention is best, which will be applied and improve their clients' socially significant behavior. Moreover, ABA should also be effective, so it should work and also be generalized, which means skills that can be completed across multiple settings and people. It is important that these dimensions be mentioned in support of societal impacts for individuals with ASD because they align with EBPs, which seek to find the best treatment for individuals that require an intervention.
McPhillamy and Dillenberger in 2013 wrote that there is significant evidence that early and intensive behavior interventions result in functional behavior. They explored the social validity of ABA-based interventions with 15 European families. The families included 17 children with ASD with ages that range from 24 months to 20 years. Parents were asked 20 open-ended questions that focus on expectations prior to using ABA-based interventions, the impact of the intervention on their child and family life, and the procedures used in the intervention. The results of the study show that ABA-based interventions had a significant positive impact on their lives in areas such as communication, challenging behavior, independence, and the family quality of life overall. There was a high level of parent support for the need for wider use of and endorsement of ABA in Europe due to the evidence that supported the interventions. In 2015, a study done by Hong et al. Evaluated the quality of research on EBP for daily living skills for individuals with ASD. Daily living skills was defined as the extent to which an individual is able to independently perform personal, domestic, and community skills. They wrote that there are 4 interventions that can help improve daily living skills, which are video modeling, behavioral in vivo procedures, visual cues, and audio cueing. For this study, 71 studies on the quality indicators developed by What Works Clearinghouse was evaluated. Evidence has concluded that video modeling is an EBP for social communication, behavior, and other skills for individuals with ASD. 22 studies that utilized video modeling and met the design standards had an effect on improving employment skills, household chores, and self-help skills.
Natalie Cutter will now provide an illustration.
I believe the best way to illustrate the societal impact of evidence-based practice is from the participants themselves. Here is a testimonial from the McPhillamy and Dillenberger study. We can now do things outside the home, such as going to shopping centers, restaurants, or going on holidays, whereas before, uncontrollable behavior made these outings very stressful. This shows the extent of the impact that evidence-based practices had on a family's life.
We appreciate your interest in this important topic. We will conclude now with a Q&A to further clarify and support our findings.
Hi, I'm Kaylee, and I'll be answering some questions regarding the standardization of evidence-based practices, as well as concluding our debate. Our first question is, what are the financial impacts of standardizing evidence-based practice? Standardizing evidence-based practices can be costly, and funding implementation is not always an easy task. According to the Department of Health and Human Services, creating evidence-based practices involves 3 steps, which include a startup phase to explore the necessity of these practices, a direct services phase to test these practices, and an infrastructure phase to sustain implementation, all of which require great financial investment. Government grants may be awarded during the startup phase. However, unexpected costs and the price of materials may not be covered. Grants may also only be awarded for short-term costs, which impact the infrastructure of standardization, a crucial phase to the sustainability of the future of the program. Costs of hiring, training, and coaching staff must be taken into consideration for all 3 phases as well. Although the costs of standardizing these practices are high, the outcome may be extremely cost-effective for families and individuals with autism spectrum disorder. The National Autism Center reports that, in a study by Michael Gans in 2007, the average cost on society for those with autism is $3.2 million. However, by using evidence-based treatment, such as applied behavior analysis, these can be cut by 65%, according to research from Krister Jarbrink and Martin Knapp. When applied behavior analysis is used for those with ASD, families are able to save money that they would otherwise spend on treatments that are not evidence-based, as well as by reducing the intensity or amount of treatment needed later in life. Our second question is, what legal example is there related to this debate? In the 1970 case of Wyatt v. Stickney, the University of Alabama's Department of Psychology filed a lawsuit to change the conditions and obtain adequate staffing for the Bryce State Hospital, a mental health institution in Tuscaloosa. The hospital was forced to fire much of its trained staff due to budget cuts, leaving doctors and nurses to take on hundreds of patients each. Not only were these patients simply housed in the hospital, the treatments used were inhumane. Patients were forced to sleep on wet floors, in rooms with little to no sunlight, and the use of shock therapy was common. Ricky Wyatt, a 15-year-old boy displaying behavior problems, was sent to Bryce Hospital despite the fact that he was not diagnosed with mental illness. He volunteered as a patient in the lawsuit to show the poor treatment he was subjected to as a result of the understaffing. One of the main outcomes in hopes of being achieved was for minimum individualized treatment, safety, and training standards to be set. The judge determined that these conditions were in fact inhumane and ordered the development of set standards that focused on bettering the treatment of these individuals. This case shows the importance of the use of evidence-based practice standards to ensure that treatment is individualized as outlined by Ethics Code 4.03, and that the client is safe and least restrictive measures are used according to Code 4.09. To conclude, behavior analysts take pride in the fact that ABA interventions are so individualized that they strive to create treatments that are geared toward each client's own needs rather than using cookie-cutter methods. Ethics Code 4.03 states that behavior analysts should not plagiarize intervention plans, including their own, but alter them in a way that they apply to each client's specific behaviors and goals. To standardize these practices would go against this core value. The lack of generality across individuals and settings due to the use of single-subject research designs in controlled environments is also cause for concern in developing evidence-based practice. A treatment that is proven effective for one participant in a study may not be effective for all exhibiting common behaviors. However, behavior analysts also have an obligation to provide their clients with the most effective research-based treatment according to Ethics Code 2.09. In addition, standardizing practices can help bridge the research-to-practice gap as described by Johnston in 2006 in an article titled Positive Behavior Support and Applied Behavior Analysis. He states that professionals in the field have come to a consensus of what constitutes a practice, but agreement needs to occur when it comes to research approaches to developing these practices. If treatment standards are determined, there will be less confusion about implementation in practice. As a group, we believe that standardizing evidence-based practices in the field of applied behavior analysis is an ethical necessity. Clients should be provided with effective interventions with respect to their rights and safety. Setting standards holds BCBAs to a higher standard and ensures that clients are receiving the best possible treatment. Thank you for watching, and we hope you enjoyed our debate.